everyone else could also soon be living with tougher restrictions. That's because the Northern Beaches cluster is still growing. 23 infections have been found in the past 24 hours, including 10 that were reported yesterday. There are now 38 cases in this week's outbreak, plus another 2 that are under investigation.
Closing time came early for Angus O'Donnell. His cafe was excited about the festive season and the chance to recoup losses from a horror year. But like most others, they've been forced to shut up shop.
It's going to be pretty bad, I think. We were shut for 7 months during the big peak of coronavirus, so hopefully that doesn't happen again.
As the clock struck 5, the lockdown came into force. Not that you could tell at Manly Beach. The only clue, everyone here is exercising. Otherwise, they risk a $1,000 fine.
But the public health order just reinforces how serious the situation is and allows us, if we need to undertake any compliance activity.
We do not want on our northern beaches to be responsible for seeding this across Sydney or New South Wales or indeed anywhere else.
Just as we saw in the last lockdown, shoppers scurried for essentials. Less than a week until Christmas, Santa was out of season. But there were again long lines at testing clinics.
Take a screenshot of the code at the end.
Dozens queued before they'd even opened.
We've had our bacon and eggs already, had a coffee, cleaned up, ready to roll in. Looks like they're starting to move right now. But we were here for about 5.5 hours yesterday, so we made it a little bit earlier.
Food proved a popular way to pass the time.
There were huge queues here yesterday. Our son was here for 6.5 hours. He had in the end to call for takeaway pizza.
For others, patience was wearing thin.
About 7 hours, and then left with no test. So it's just not good enough.
Worshippers are hoping and praying churches will reopen by Christmas.
People were here on the driveway in their cars, actually praying in front of the church.
An Avalon gym is among dozens of alerts across Sydney. The Premier fears the situation could get worse before it gets better.
It seems apparent to us that we'll have around the same number, if not more, cases tomorrow, and that's why we've taken the action we've had.
Now, the rules of this lockdown will be familiar to most of us. They're the same as those of earlier this year. So at this stage, they only apply to residents on the Northern Beaches. That's an area stretching from Manly to Palm Beach in the north and west to Frenchs Forest. Until midnight on Wednesday, people living inside this zone are only allowed to leave the house for 4 reasons. They are work, shopping for basic needs, exercise, medical reasons, or to provide essential care. Police have the power to issue fines up to $1,000 to anyone caught breaking the health order. And people in Greater Sydney are being told to cancel their plans and stay home. The abrupt pause on the festive season is dealing a real blunt shock to businesses, and the health alert is seeing people flock to testing sites, creating massive queues and waiting times.
Bumper to bumper at Bondi, as the effect of the Northern Beaches cluster is felt in the city's east.
I've got family in the Northern Beaches, so I just thought it would be best.
It has been quiet at this testing site for weeks, but suddenly the queue is 6 hours long.
I got here at 8:45. I got here a bit earlier than it opened and still here.
We've been in the car now for 4.5 hours and nothing to eat, nothing to drink and no toilet.
Obviously, the government's not organised enough to be prepared for this.
A coronavirus case visited Bondi Westfield on Tuesday, as did another to a cafe northwest in Riverstone.
Our staff have all been all off now and they're getting tested and they won't come back until the results come in.
Further south, residents were doing their bit to boost testing numbers.
A little bit unwell. Felt like I've had the flu for a couple of days, got to develop a bit of a cough.
I was in Manly on Friday, so I thought, might as well do it, just in case.
In Parramatta, wet weather sent people indoors. But across the city, businesses have been receiving scores of cancellations. Emma Withy has been fielding some of the calls.
So we saw like a huge decrease in bookings. We had hardly any walk-ins last night. I was meant to work, was called off.
Others are also feeling the effects of the latest outbreak.
I think Bondi just as a whole seems really quiet. So yeah, we've called people off and everything. So yeah, it's been quite full on.
While it's only the northern beaches in official lockdown, people across the city are effectively being asked to do the same thing. The Premier is pleading with Sydney-siders to stay at home unless they have to leave for essential reasons. The Premier says Greater Sydney should be prepared for tougher restrictions.
We are still considering that. I just want to put everybody on notice that that is a possibility.
We'll see over the next 7 days how many secondary cases we'll get of that, and hopefully with people staying at home we'll get few.
It has cast doubt over Christmas plans.
I think everybody's plans are upside down.
You know? And just close family.
Simple.
Unless we see a dramatic change, it's going to put a brakes on a lot of what we are planning to do.
Getting to the normal again, and then that happens, and yeah, I think just frustrated.
An ever-changing new normal. Kathleen Ferguson, ABC News, Sydney.
To some breaking news now. This year's Sydney to Hobart yacht race has been cancelled amid coronavirus concerns. In a statement, race organisers say safety is top of mind for everyone involved, but they're bitterly disappointed to make the call. Now, this is the first time in 76 years that the race will not be conducted. Western Australia will reinstate its hard border with New South Wales from midnight Western Standard Time, with travel from New South Wales no longer permitted without an exemption. The ban applies to anyone who has been in New South Wales since December 11.
Given the size of the Sydney outbreak and recent advice from this afternoon's AHPPC meeting, our Acting Chief Health Officer has recommended that New South Wales now move from being a low-risk state to a medium-risk state. This means, effective from midnight tonight, that is 12:01 a.m, Sunday, December 20, the hard border with New South Wales will be reinstated. This is the highest rating of any state or territory. Only Victoria, South Australia and New South Wales previously have been given this risk rating. As a result, travel from New South Wales will no longer be permitted unless you are an exempt traveller. This also applies to anyone who may have been in New South Wales since December 11 and hasn't completed 14 days in a lower risk state or territory. This means from midnight tonight, they will need to meet a strict exemption category to enter WA. This exemption system is the same arrangement as we have used before. The exemption list for New South Wales is limited to certain senior government officials, certain active military personnel, a member of the Commonwealth Parliament, a person carrying out functions under the law of the Commonwealth, a person responsible for freight, transport freight or logistics, and anyone given approval by the State Emergency Coordinator or an authorised officer. The final category includes compassionate reasons, including those West Australians that may have travelled to New South Wales recently and need to return to WA. These people will be assessed on a case-by-case basis and will be required to complete 14 days of self-quarantine.
Victorian authorities are considering declaring all of Sydney a COVID hotspot, but so far have stopped short of closing state borders. It comes as Victoria recorded its 50th straight day without community transmission. Margaret Poole has the story.
Touchdown and test.
Where are you travelling from today?
From today, anyone arriving from Sydney is being encouraged to get a test.
We understand what Melbourne people have been through for many months. This is the least we can do.
Melbourne Airport was host to a lot of changed plans.
My sister was meant to come from Melbourne and we're meant to all have Christmas together in Manly, where my brother lives. So obviously that's all been cancelled now.
It all went smooth and I'm great to be home, and it's scary too, just wanting to get out.
I just think after what we went through in Melbourne this year, I didn't want to live through it again.
That's a view shared by authorities as Victoria recorded its 50th straight day of no community transmission.
That's a precious but wonderful achievement, and I want to thank all Victorians for their efforts.
From today, people aren't permitted to enter Victoria from Sydney's northern beaches. Those from Greater Sydney are being asked to get a test. If the virus has spread, the government will make the whole city a red zone.
That will mean anyone who has been in Sydney will not be allowed into Victoria.
6 people who have travelled from the Northern Beaches are now in hotel quarantine in Melbourne, including 2 unaccompanied minors and their carer.
That family from the red zone will be spending Christmas in hotel quarantining.
There are 2 new cases in hotel quarantine in Victoria, bringing the total to 10. While air borders are being toughened, there was no visible police presence at this main border crossing in Albury.
We need to have a consideration about what the actual risk is just across the border in New South Wales, and regional New South Wales is not anything more than a negligible risk at the moment.
But authorities say they'll close the border if they need to.
I'd certainly encourage the Victorian Government to keep our borders open. It's really important for our community.
From today, anyone entering Victoria from New South Wales needs a permit. So far, more than 52,000 people have applied. The system's likely to be in place for at least the next 2 weeks.
Well, the growing cluster is having far-reaching effects. Many of those on board an afternoon Darwin to Sydney flight were still unsure about what will happen on their return to the Northern Territory.
The outbreak in Sydney's Northern Beaches has thrown some Territorians' holiday plans into disarray. Plenty of travellers at Darwin Airport were ready to risk the trip to New South Wales.
Not actually Sydney, I'm going down the south coast. So I just get picked up at the airport in a car and drive straight out of there without breathing Sydney air.
I think New South Wales have got it under control. Got belief in them.
With the Northern Beaches already a hotspot, those staying in Sydney are worried about having to quarantine on the way home if more areas are added to the list.
I am a little bit worried, but my daughter seems to be okay around the Botany area where she's staying, so fingers crossed.
But other passengers transiting to places like Canberra were willing to spend 2 weeks at Howard Springs if the outbreak spreads.
We've been in the remote community for the whole year now and we haven't been able to see our families. So it's a tricky decision, but I think for a 6-week holiday we can spare 2 weeks to quarantine when we come back if we need.
Most state authorities have responded today, along with Australia's Chief Medical Officer, but in the Northern Territory, no one was speaking. Only a statement from the Health Minister's Department saying the NT government was monitoring the situation in New South Wales. That statement also confirmed one person who had recently been to the Northern Beaches is in quarantine at Howard Springs, while another is headed back to Sydney after quarantining for 1 night in Alice Springs. It comes as 2 more people test positive to coronavirus at the Howard Springs facility, a 77-year-old woman who arrived from Chennai on Monday and a 56-year-old woman who arrived from Paris on Thursday. Cameron Gooley, ABC News.
Australia still doesn't have a coronavirus vaccine, while health officials in the United States have just given the green light to their second. Millions of doses of Moderna will start rolling out within days. It provides almost 95% protection and comes just a week after the Pfizer vaccine was approved. ABC correspondent Greg Jennett reports from Washington.
On this one, the number 2 went first. Mike Pence, his wife and the Surgeon General.
Karen and I were more than happy to step forward to take this safe and effective coronavirus vaccine.
Great job. All up to take the shot that the President has not.
I got the facts and I made a choice to protect my health.
Politicians were never at the front of the queue for the first vaccine.
Okay.
That was reserved for health workers and now for nursing home residents. Like Jean Peters in Hartford, Connecticut.
I'm 95, but I'm still counting.
Soon, stocks will be bolstered for others now that approval's been given to release almost 6 million doses of a second vaccine made by Moderna.
We are poised to have vaccine for 20 million Americans before the end of December. It is truly a medical miracle.
The Christmas break is looming, but the pandemic pauses for nothing, especially not in a country where more than 17 million people have been infected. Daily deaths from coronavirus are stuck above 3,000. Modelling suggests it'll soon climb above 4,000. Proof positive that America's hurting and its pain will stretch into another wretched year.
Snow is falling on the trees.
But in the spirit of the season...
And then the tinsel, I mean, he's like so particular, like
one
strand at a time.
You can't
See?
throw it on there.
Is there any credit Joe Biden could give the current president?
I think what he's done, getting the vaccine moving, has been positive.
He gets his vaccine shot next week. Greg Jennett, ABC News, Washington.
With more than 10 million cases, one country is playing a pivotal role in the global fight against the virus, and that's India. The country's ability to produce affordable drugs has earned it the reputation as the world's pharmacy. Its manufacturers are already pumping out tens of millions of vaccines that are cheap and easy to store. South Asia correspondent James Oaten reports.
This is Pune, one of India's premier education cities, known locally as the Oxford of the East. It's also home to a powerful weapon in the fight against COVID-19. The world's largest vaccine manufacturer.
It's an immense and huge sense of responsibility that now rests on our company's ability to perform.
When the pandemic struck, the family-owned company overhauled its assembly line and bet big on various coronavirus vaccines long before the data was clear. One of them is the Oxford AstraZeneca jab.
It was not only a big gamble, but also it was a calculated risk.
The company can pump out a whopping 500 doses a minute and aims to produce up to 400 million by April. The Pfizer vaccine has been widely heralded as the beginning of the end of the pandemic. But for countries like India, it has two major drawbacks. It's expensive at nearly $50 a dose, and it must be kept at incredibly low temperatures.
Ultra cold storage facilities which are available in the West, like minus 70 degrees centigrade, are just not possible to be replicated in India.
India's been a testing ground for vaccines that are expected to be much cheaper, around $4 to $8 a dose, and only require normal fridge temperatures. Neurologist Dr. Padma Srivastav volunteered for a locally developed vaccine, Covaxin.
When my institute was part of the trial, I thought this is a great opportunity to be part of science and contributing to it.
We should understand that these vaccines which are made in India are not only for the Indians, but is also for the whole world.
India isn't the only major player in vaccine production. China is also pushing its products and already has Indonesia locked in for millions of doses.
Frankly, they think that it's a two-legged race only, and they think that they need to beat the West. The Indians will not be so pushy.
Look, for the first 2 years, there will be a shortage and a kind of chaos, but things will settle down and everyone's going to get the vaccine.
There's hope on the horizon. James Oaten, ABC News.
Hospitals in the United Kingdom are struggling to cope with more COVID admissions now than they had in the first wave. New data shows that 1 in 95 people in England had the virus last week. Those on the front line say the growing infection rate is having a knock-on effect across the hospital system.
We're now at a really dangerous point where we could tip into finding it incredibly difficult to manage.
Now, despite advice from public health experts, Prime Minister Boris Johnson is still allowing rules to be relaxed over Christmas. But he has warned England may follow Wales and Northern Ireland into a post-Christmas lockdown.